Happy Sunday evening to everyone. Thank you for joining me on this. Well, it's nice and sunny here in Northeast Tennessee, so I appreciate that you all taking the time to join us. We've been doing these now. This is our third live social media live stream that we're doing. We're streaming this on Facebook, Twitter, and on YouTube. So drop in the comments where you're joining us from. Would love to know who's watching. And just a reminder, we will answer questions if you drop questions in during the live. We'll watch for those and answer those as they come. And if you drop them in after, I'll try and monitor that to get you answers in the chat, but it obviously won't be live. But please feel free to interact and drop in questions, and because we want you to know that we are watching. So that we can, get questions answered regarding Medicaid expansion, because that will be the topic that we'll be discussing today. But my name is Kate Craig, and I'm running for state senate here in District 3, and that's Washington, Carter, and Johnson counties. And I've been really humbled and honored by this experience because I get to talk to voters just all over. And I'm running against an incumbent who has been in office for 32 years, and he helped create the largest monopoly in the nation, medical monopoly in the nation, by changing the state's antitrust laws. He co-sponsored legislation that requires teachers to censor their books, and just has done just so many awful things that my campaign slogan is, we just need some common sense, not corruption. And quite frankly, we need a whole lot more common sense in Nashville, because these issues that bring us all together, that have us all wanting change, they're issues that aren't Democrat or Republican. It's not Democrat or Republican to want our kids to have a good education. It's not Democrat or Republican to want a good paying job or a roof over your head. None of those things are partisan, not one of them. But yet we as Tennesseans are struggling. So I stepped up to run for office and I've been an organizer here in Northeast Tennessee for years. And I see the potential that we're losing out on because we're not doing this. We don't have common sense there. And our elected officials aren't looking out for us. They're too busy looking out for their own power, their own gain, and protecting their PAC donations, quite frankly. And so I'm running because I think it's a community thing, and elected leaders should be responsible to those they represent. So I want to share a story, and I think this is a good segue. From yesterday, I was tabling at Emancipation Day. And for those that don't know, Tennessee's Emancipation Day is August 8th. And unlike when the Emancipation Proclamation happened, it did not include Union-occupied territories, which included Tennessee. So in that, emancipation did not happen for Tennessee until August 8th. So we celebrated it, Emancipation Day, on August 20th. It was originally scheduled for August 6th, for those that remember, but the storms that were forecasted rained it out. And so we did it today on August 20th, yesterday, and had such a privilege of talking to voters that were coming through. And this one woman shared a story that she works at the hospital here. And a patient had come in, and this woman's house had burned down. And she was there for being treated for smoke inhalation and had nowhere to go, and was given about $500 to basically saying, good luck. And this hospital employee who did not know this woman took her in because she knew that this woman would essentially be homeless without somewhere to go. And so these two strangers, like this, what a community is supposed to do, this woman took the other woman in and is helping in every way, shape, or form. Something else that's important to know is that if you are on oxygen, that they won't deliver an oxygen tank unless you have a physical address. So part of her care required that, meaning she also needed that physical address. But I really want to talk about the legislation. So if this woman's house burned down, she could have potentially been homeless. And yet we have a state senator who voted to criminalize homelessness. So this woman could have been out on the street because of circumstances just that happen to people. It's just horrific experiences, be out on the street. And she could have been locked up in jail, lose voting rights, just kind of been all kinds of things that could have happened. And that's not the community we need. That's not common sense. That's not a lot of things. We have a lot of people in our communities that are homeless, and we should treat them with kindness and care and provide resources and healthcare and mental health care and address the job opportunities that are in that area, just the housing crisis that's in the area, because criminalizing homelessness does not change people, whether people are homeless. It just doesn't. So instead, I think we need to address it with compassion and talk about it in a much different way. And so these stories, like this woman the woman's story who got shared with me yesterday, it really touched my heart. And so you're probably going to be hearing more about that story in the future. But I wanted to be sure to kind of share that with you all, because that really touched my heart. Because when we say politics is impolite conversation, it's not. We're talking about people's lives. We're talking about people that we care about, people in our community. It's talking with a heart and caring about education, housing, jobs, healthcare, the GoFundMe that the neighbor has. All of that's politics, and all of that we have a heart for our neighbors, our friends, our community members. So I hope that you all are having these conversations and listening, because it's so important that we do. So yes, I want to share real quick. Eric Coleman put in the comments, common sense equals making common decency a common practice for the common good. Eric, you couldn't be more right. So thank you for tuning in here today. So let's see. I want to go ahead and segue into talking about Medicaid expansion, because, I mean, this is an opportunity that Tennessee has had since January 1st, 2014, with the passage of the Affordable Care Act. And goodness knows people have tried. Governor Bill Haslam tried to get Insure Tennessee, which was expanding Medicaid in Tennessee, and the Republican legislature, even though he was a Republican, they were against him and did not want to do this. So this has been a bipartisan supported issue that we just cannot seem to get past. 78% of Tennesseans support expanding Medicaid. It's popular. We all know the good that it will do. And it's also important to note that for today, it's $2.1 billion annually that we just throw away. These are tax dollars that we have already paid, that we just say, some other state can have it. We don't want it. And I realize that $2.1 billion is probably a lot to conceptualize. So in daily terms, that's $5.75 million that we say we don't want. That's a little easier to wrap our heads around and going, gosh, that's a lot of money. So I want to introduce our guest here who has joined us, Dr. Michelle Fiscus, and let me add her to the stream. Thank you, Dr. Fiscus, for being with us. And I'll let you go ahead and introduce yourself for everybody who's watching.
Sure. Hey, Kate, it's good to see you again. So I'm Dr. Michelle Fiscus. I'm a board-certified pediatrician. I used to practice outside of Nashville in Williamson County for about 17 years before I went to Tennessee state government, first in the Department of Health and their maternal child health programs, and then moved to be the medical director of the immunization program there, and then led the COVID-19 vaccine rollout for the state of Tennessee. Last summer, my family made the decision to leave Tennessee and move to Northern Virginia, where we've been for just coming up on a year now, and moved up here without jobs, and actually am someone who is insured now by the ACA, by Obamacare. And I'm very happy to have that as an individual who is not capable of qualifying for insurance on my own, because I had cancer 6 years ago and no one wants to insure me. But we are here in Northern Virginia, and I'm working on as a consultant on the national level now to improve immunization rates largely, and to also modernize public health. And so I'm excited to be with you. I lived in Tennessee for 24 years and raised my kids there. And, we miss some aspects of the state, but it's good to be able to keep in touch with folks like you, at least this way.
Well, thank you. And I mean, we do miss you in Tennessee, but I understand, with all that's happened, and Northern Virginia is a wonderful place. And so I'm excited about your business that you're opening too. So
Yeah, it is. It's a great place to be. We've really enjoyed being up here. Not to mention the fact that the humidity here is like a tenth of what we were experiencing in Tennessee. So this summer has actually been pretty pleasant. And I was having lunch with a colleague the other day, and I said, "Is this a typical like DC kind of summer?" And she said, "Well, I mean, it has been really hot." And I was like, "Honey, you have no idea what hot is."
oh, well, let's jump right in. So I'm going to throw up a map here that Tennessee is one of 12 states in the nation that has not expanded Medicaid. And I kind of mentioned a little bit earlier that, we even had a Republican governor that tried under the name of getting Insure Tennessee passed. And so I wonder if you wouldn't mind to talk about some of that fight, that, kind of what you've seen happen, and even like some of the opposition towards it, because to me, this is common sense, reduce, it would reduce state and local bills, would bring billions of dollars back into the state, as well as get people coverage, so that obviously they could be working and better equipped, cover more children. But so I don't understand why it's not been passed.
Yeah, it really is pretty astounding that Governor Haslam tried to do this and wasn't able to get it done with a legislature that at the time wasn't half as um, I don't know, polarized, I guess, as what we see now. And I think the bottom line is what happened is that you've got the ability to expand Medicaid that came out of the Affordable Care Act, which was something that a Democratic president did, and now you have the opportunity for bonus money to come into the state for 2 years as a result of the American Rescue Plan, but also under a Democratic president. And really, this is what things have come down to. Unfortunately, this isn't a legislature that is looking for what's in the best interest of the people. It's just doing things to be spiteful because they don't want to support something that a Democratic president has put into the plan.
Yeah, I mean, it's straight up playing politics with people's lives, and nobody wants that. Like, that is not, it's not why anybody should be in Nashville. It's not why anybody should be in any office, quite frankly. And because you're elected to go there and serve. So it's incredibly unfortunate that politics and partisanship took precedence over representing people and doing what's best for Tennesseans.
Yeah, and I mean, we keep hearing this narrative over and over and over again. One of the reasons, well, the reason I left the state was because I was fired from my job at the Department of Health for trying to get people vaccinated against COVID-19, and that was yet another one of these things where it was driven by the legislature, by certain representatives in the legislature. And again, it wasn't because they were doing what was in the best interest of the people that they were sworn to protect. It was doing things that they thought was in the best interest of them politically, and to, just be completely unwilling to support anything that comes up that's meant to protect people.
Yeah. Well, as we're talking about the people that are affected, I'm going to put up another statistic that talks about those that are in the gap, because I think that there's a lot of question, even like, what does that gap look like? Because it's hundreds of thousands of Tennesseans who don't have access to healthcare coverage. And there's in District 3, there's around 25 to 30% of the district that are under the age of 65 that don't have healthcare. Now, not 100% of them would be able to be covered if Medicaid was expanded, but this would be a great step in that, to get more people covered. And so we see there's families, there's there's a lot of the working population, those in construction, those that are working in restaurants, fast food places. And the number one employer, the type of employer in Northeast Tennessee, is the hospitality industry. And so you've got minimum wage, part-time, no benefits workers. So a lot of people in Northeast Tennessee would significantly benefit from this. So can you talk a little bit about this population and what you've seen in terms of access to healthcare?
Well, you think that, one really important thing to realize too is that just like with everything that is negative that impacts folks, there is this disproportionate impact upon people of color. So the Black population in Tennessee is about 17%, and so you see they should only represent 17% of this graph if things were proportional to the population, but that's not true. And in many cases that is because it is the Black population that is serving in those low income hourly wage jobs in a lot of cases for so many factors that involve historical discrimination and racism and things that prevent people from going on to seek degrees in college and in trade schools. And so this is the group that ends up being disproportionately impacted by something like this. Um, just thinking about this in plain terms, because I think a lot of times people think, well, this is an entitlement program, and so I'm going to have to pay more to be able to pay for insurance for people who should just get off their butts and go work harder and get jobs where they can get insurance. And I think the examples that you brought up, Kate, of the person whose house burned down, who maybe doesn't have good coverage, or in our case, we took in a young man in 2019, I think, who lived with us or 2018, who lived with us for about 2.5 years, who was working two jobs. He worked Burger King and he worked in the kitchen in a retirement center, and worked 7 days a week, worked you know, 7, 8 hours a day, but it did not have insurance through his employers. If he wasn't covered under his mother's insurance to age 26, he's one of these single people who doesn't make enough, who cannot qualify for Medicaid, but also wouldn't be able to afford private insurance. And his birthday is this week, this Friday, and he's going to be 24. So he's got 2 years left to figure out what he's going to do for insurance, because he would probably qualify for Medicaid if Medicaid was expanded. But in Tennessee, the qualification to be covered by Medicaid is that you have to be, I think it's 93% of the poverty level. You have to be living under the poverty level by 7% in order to qualify for Medicaid. And that's if you're an individual who has kids. If you are a single individual in the state of Tennessee who is a low wage earner, you cannot qualify for TennCare. There's no way to do it. But if the expansion happened, it would go up to 138% of poverty and would allow some of these individuals who don't have children, who are single adults, who are working low wage jobs, to be able to afford health care. The other issue is that when people don't have insurance, they don't get preventative care. They don't go see doctors. They don't get mammograms. They don't have their cholesterol checked. And so when they go to get care, it's going to be through an emergency department, because the local urgent visit places don't take Medicaid and they don't take uninsured people. So without primary care, with your only source of care being the emergency department, when you go to the emergency department, then you can't afford to pay those astronomical bills that the emergency department gives you. And if you've been to an emergency room, I mean, the clock starts ticking the second that you walk in the door, and those bills are tremendous. And so what happens to those bills is that the hospital ends up eating the cost of the care for that individual, because they can't pay the bills, or you end up with someone who's in medical bankruptcy because they can't afford to pay their bills. And when you have a small hospital, like especially what we've seen in rural Western Tennessee, when the population that they're serving is maybe 25 or 30% uninsured, that hospital cannot continue to just absorb the costs of taking care of those individuals. And that's what stresses them to the point of closing. And when hospitals close, then businesses don't want to go there. People don't want to move to those communities. really, it's a huge driver of the economic health of that particular community in that area, and is, kind of in the canary in the coal mine of ensuing death of what's going to happen in that community because of the loss of that hospital access.
Oh, definitely. And just talk, kind of bringing this back to 2018 when the two hospital systems here merged, when Wellmont and Mountain States Health Alliance merged. I believe, I mean, like, I'm a believer that if Medicaid had expanded, they would have had a less of an argument to even be able to merge those two hospital systems. So, and this is something I would also want to point out, that Rusty Crowe sits as the chair of the Senate's Health and Welfare Committee. So if you sit as the chair, you get to control that agenda. So why on earth has he not championed this piece of legislation? The former CEO of Mountain States Health Alliance was a champion of Medicaid expansion, believed in it. The current one is not. And with the medical monopoly that we have, so we have people that are going in that cannot afford their medical bills, and we have an uptick in the number of medical bankruptcies in this area, the amount of medical debt that is just on the rise. And so people are hurting, yes, because of the medical monopoly, but compounded because we haven't expanded Medicaid. So it's sort of a double whammy up here.
Yeah, and no one should lose their home because they had some terrible medical thing befall them, and it doesn't even have to be that awful. I mean, you could need to have your gallbladder or your appendix out and end up losing your home because you had to file bankruptcy, and you can't afford to pay your mortgage anymore. It's really a travesty. When you look back at the map that you showed, Kate, those states that have not expanded Medicaid now are the states in the country that have the strictest requirements for getting on Medicaid because they didn't expand. They all require people to be living below and sometimes well below the federal poverty level. And these are also the states that have some of the poorest outcomes for health, have some of the highest maternal mortality, infant mortality rates, the highest medical bankruptcy rates, the highest rates of substance use disorders. There's no coincidence here that when people don't have access to healthcare, that we end up with really poor health outcomes, and that really impacts all of us.
One of the things we talk about up here in Northeast Tennessee, and obviously addiction and substance use disorders affected people statewide and even up and down the Appalachian region and so on and so forth. But it hit Northeast Tennessee incredibly hard. And especially with COVID, overdose rates were on the rise. So there's been lots of talk around how Medicaid had been expanded. There'd be more resources coming into communities to be able to help address that. So we have the lawsuits that are happening, the settlements. Up here recently, there was the Baby Doge settlement that happened, and all of that, or a good chunk of that money, is going for those who are justice involved. And that's great. There should be addressing stuff for those who are justice involved, but what happens to everybody else that's not justice involved? And so, if we had more money coming in, that would to help with those resources, to help, because emergency departments are the front line for those coming in either overdosing, seeking treatment, something.
Yeah, and really any mental health issue, the emergency departments have largely been the front line, and you cannot afford to get the help that you need if you are uninsured. You just can't. I mean, the kids in Tennessee, the threshold to get into Medicaid is much, much higher. It's something like 250% of poverty. And so kids under the age of 18, they're either on Medicaid or they have private insurance, unless they are undocumented children, and in which case, we really wish that they would have access to Medicaid as well. But that's a relatively small percent. But when you're looking at the adult population and you've got 25-30% that don't have insurance, don't have Medicaid, there is not a treatment program anywhere that individual is going to be able to afford to attend, or a therapist, or anyone else who's going to really be able to help them with their mental health issues. And even if they're able to find a place that's on a sliding scale, they're worried about keeping the lights on if they have a home to have lights. They're worried about where their next meal is coming from. That isn't money that they've got that they can spend on taking care of themselves and around their mental health concerns.
Yeah. And like you, I have health insurance through the ACA. And I do qualify for a subsidy that would normally be around like $500-600 a month for insurance, and without it, it's just under $300 a month.
Mm.
But within that, it still doesn't kick in until I spend $5,000. So there's a whole bunch of, I mean, medical expenses. I mean, they're expensive. So when we talk about this, I think a lot of people also conflate insurance and health care. And right now, with Medicaid expansion, really, like, yes, there are access points that limit, but it's really about health insurance. And so there's a lot of, oh, we don't want socialized medicine. And that's a very common trope around this. But really, this is about health insurance.
It's nothing to do with socialized medicine. And, you have a $5,000 deductible, Kate, I have a $7,000 deductible. I'm thankful that I have the resources to be able to manage that. But insurance through the ACA is not cheap. And if you don't qualify for a subsidy, I think it's about $2,000 for me to cover myself, my husband, and my daughter through the ACA. So it's a month, $2,000 a month. So it is not cheap to do that. And as you said, it's not like if you have ACA insurance that you can just still afford to go see a doctor or get something done outside of routine well care that's usually covered at 100%. So I'm grateful that it's there, because as I said, as a cancer survivor, there isn't a private policy that will touch me with a 10-foot pole. And if I don't have insurance through an employer, which I lost when the state fired me, there was nowhere to get insurance except through the ACA. But that is not the remedy for everyone, unfortunately. Now, what does help is if we expand Medicaid, then a lot of the population that is in coverage under the ACA moves off into Medicaid, and there's actually some opportunity that some of those premiums that we see through the ACA could come down as you move out maybe a sicker, older population into the Medicaid program, which would also help people across the board. And then I think that the other really important point to underscore here that you made at the very opening of this is money that we're paying anyway. That every person in Tennessee is paying federal taxes that are going into this Medicaid fund, and by the state refusing to take its $5 million of taxpayer money every single day because they chose not to expand Medicaid, that $5 million of Tennessee money is just being divided amongst the states that had enough sense to expand Medicaid. And being given to support their population instead. And why we're not using that to support our own is just it's just unbelievable how the heels are dug in, because this was something that a Democrat decided to put into place, and they just can't get past that. I said recently with some of the rules on the federal level, like the law around helping veterans who were exposed to burn pits, that if a Democrat wanted to support mom and apple pie, I think the Republicans in this generation would vote against it. And it's really frustrating, and it's really sad that there's this much power in their hands that is just being used to do everything but what they're supposed to be doing with it.
Absolutely. At one point, the state legislature tried to pass block grants, and they were wanting to do that in place of expanding Medicaid, but that was going to be their solution. And everything I understood about it was that it would limit the number of people, because basically the population that qualifies for Medicaid kind of expands and contracts based on needs of what is happening. And yet, as it did that, it would cut people out even if they would qualify, because of the way the block grant system functions. Am I understanding that correctly?
Yeah, the thing about block grants, and so instead of the state needing to do things as the federal government kind of prescribes, where, okay, you're going to spend this amount of money on this and this amount of money on that. What a block grant means is that, okay, we want you to give us just a great big chunk of money, and we get to decide what we're going to do with it. As a pediatrician, block grants terrify me because kids get cut out of everything anyway. And so block grants are a great way to make sure that we don't provide for children, because they are an inexpensive population to help. And so and they don't vote. So a lot of times the kids end up with the short end of the stick if they just give a pot of money and tell adults to divide it up the way they see fit. The other thing is that that pot of money is pretty good if the economy is doing well and people are insured and people are paying taxes. But when you really need the insurance is when it hits the fan, like it did with COVID. And so when you suddenly have a ton of people getting unemployed because the restaurants have shut down and everybody's out of work and they've lost their insurance and have to go on Medicaid, then you suddenly have this population of people on Medicaid that just suddenly got huge, and you have a pot of money that is retracting and becoming smaller because now we don't have the resources coming into the system to pay for those individuals. And so it will be sold as, oh gosh, we can do such a better job deciding what to do with our own money. And the reality is that when times get tough, you do not want to be in a block grant situation, or you're going to end up with a whole lot of people that get a whole lot of nothing, because too many hands are needing help, and there's not enough money to go around to pay for the care.
Well, just to kind of point out that we've got this rainy day fund with billions of dollars in it. And I'm sorry, but it's flooding, not just raining, it's flooding in Tennessee, and they still won't spend it. I'm not suggesting we should go zero, but they should do something.
I've often wondered what rain looks like to this administration to have. It'll be $8 billion this year in that rainy day fund. What does it have to do do things have to start spontaneously combusting for them to use this money? Because we've had floods and we've had plagues and we've had tornadoes and we've had fires, and I just don't know when they would ever decide that's a fund that they want to chip into. It's just I don't know, some kind of badge to be able to say that they've got $8 billion squirreled away somewhere of our money, your money, my money, that they're just sitting on. This has just boggled me for years.
I just want to share Eric's comment here. I think that's an important comment I want to bring up and highlight, I should say. So thank you, Eric, for adding that. But yeah, on top of that, even within COVID, it was something, I think I read a report, it was in 30 to 40% of small businesses that were shuttered because of it, that we've got a teacher shortage that is happening, that, hospitals are closing, and they've been closing these rural hospitals. We've got hospitals that have been downgraded up here, and a housing crisis that, rent up here is almost doubled, and people are getting priced out of their homes. So, and wages have just remained stagnant. And is the cost, really the wages have gone down in terms of how far they go as costs go up. So my dollar goes less far. It doesn't cover as much.
Right.
So,
yeah. And I'll quibble about the vernacular. I don't think we have a teacher shortage. We just have teachers who have been so incredibly abused. They're, in this state and others, that they've been vilified. My daughter was an early childhood education major at University of Tennessee, Chattanooga, and has switched to business because, who wants to be a teacher anymore? And, these are people who are out there still in a pandemic with no mitigation strategies whatsoever in schools, bans on even the ability to mandate masks in a school unless the numbers are so incredibly high and an emergency declaration is made, which will never happen again, that, who you'd have to be crazy to stay in education at this point, to put your safety and your health on the line, and to have all of these mandates. I have friends who are in elementary education who are sitting there logging every book in their little classroom library now as it comes under scrutiny, so that the big brother folks, wherever they are, can read the list and decide which books children are allowed to read and which ones aren't.
I'd like to point out Rusty Crowe was a co-sponsor of that bill.
It's just insane. And to see, I have said many times that in the 10 months or so since I left Tennessee, it feels like it has devolved so much, that things have gotten so much worse. And since I've left, it's gonna make it sound like because I left, all this stuff happened, which is not what I'm saying. I'm just looking from the outside. We've got 4 days until the near total abortion ban goes into effect. This stuff about banning books and all the Big Brother stuff. There's just so many things happening that it's I don't know. It's sometimes absolutely surreal that these types of things are happening. But there you go.
No, and you mentioned the trigger bill that's happening, and I believe it's going to take effect the day before the 102nd anniversary of women's suffrage passing in Tennessee. What a way to commemorate that. And I say that with all laced with sarcasm. But I mean, we now live in a state, and another bill that Rusty Crowe helped to co-sponsor, this trigger bill passed in 2019, that if a 10-year-old girl gets raped, that she will be forced to carry to term. And that is there's no justice in that. Yeah. I mean, the 10-year-old could not go adopt, could not anything, but yet we're going to say, no, go ahead, go do this. So
yeah, and the legislature made it loud and clear last year that even though Tennessee Supreme Court case law states that a 14-year-old has the right to make their own medical decisions, which would apply to choosing to get a COVID-19 vaccine, they've now outlawed the ability for a mature minor to get a COVID-19 vaccine, but they would be forced to carry a pregnancy to term if they were raped. Yeah. Again, I run out of adjectives and adverbs to describe the kind of stuff that's happening.
Well, I mean, absolutely. And as you also pointed out earlier, we are also a state with one of the highest maternal mortality rates. So on top of the fact that we're going to then require people to give birth, that now we're going to put their lives at risk on top of that, not just for the fact of it's a non-viable pregnancy, that if something is happening in the pregnancy, that to save the life of the person carrying, that that the only way forward is to terminate that. I want to say on top, it's just sad. It is just so sad and harmful, and it's dangerous. And then to compound that with, people are going to be desperate and trying to handle things on their own. So whether it's a coat hanger or going to be this concoction that they saw on TikTok or whatever, that they're going to be trying to perform home abortions, and people are going to die because of it.
Yeah. Oh, absolutely. When I was a resident in Indianapolis, I was on OB service when there was a 12-year-old that came in who was pregnant and delivering. And I will never, ever forget watching that poor child try to deliver a baby. There's just nothing sadder and at the same time, they're going to talk about, well, you can't talk about sex, you can't talk about birth control, you can't access birth control. The number one way to prevent an abortion is to make sure that people have accurate sex ed and access to contraception and women's health. So, it seems like if people wanted to stop abortions, that's what their focus would be, instead of taking away a woman's right to choose what to do with her body.
Absolutely.
But I've gotten you off Medicaid.
Well, I feel like it's all connected though when we're talking about healthcare, because again, what's going to happen to that 12-year-old after giving birth? What's going to happen to that child? It's just literally, it's this cycle that perpetuates.
Right.
And so then it limits economic viability, it limits housing, there's just, you just create a cycle and they don't care.
That's right.
So all of these are interconnected. Um, if you were to leave everyone with one thought, one thing about Medicaid expansion, and the biggest reason you could think of to expand it, what would that be?
Well, Medicaid expansion helps every single person in the state. The people who are paying into the system, who are having their healthcare system taxed because we have people who have to seek medical care that they can't pay for in the same facilities that people who can pay for medical care are in. So, if you think that if we don't expand Medicaid, it keeps things better for you in some way, that's not the case. Your same hospital system, your same doctors, your same healthcare infrastructure is having to cover the cost of the healthcare for people where we have already paid that money in to the system. We should be able to use those federal dollars that we've already spent to pay for the healthcare of those individuals that need it, and that's not happening. And I just I think the biggest reason too is just from just a human kindness, support for humanity angle. I mean, it's just the right thing to do to make sure that people have access to their basic needs, which includes healthcare and food and shelter and just those basic things that we all enjoy. And failing to expand Medicaid doesn't make it better for the rich people. It makes it worse for them too. So we should all collectively be working to do this. And as you said at the beginning of the hour, Kate, this is something that 3/4 of the state of Tennessee supports. But we have people in the legislature who control what bills get heard and what gets voted on, and the bottom line is we're the ones that put them into office. And in November we've got an opportunity to change that. And for goodness sake, should anybody be in a seat in government for 32 years? That's absolutely ridiculous. It's time to get some folks in that are going to do the business of the people. And Kate, I hope we're going to get you there.
Well, I'm sure going to work real hard to get there, and I know that everybody watching is going to work real hard to do that. So, in speaking of that, that's also a perfect time to say, if you're interested, please sign up to volunteer. I need your help. So we have lots of volunteer opportunities coming up. So either sign up on this at katecraigtn.com/volunteer. Or I have 3 big events that are coming up over the next week and a half. Is that the Appalachian Fair kicks off tomorrow and goes through Saturday, and need volunteers out there. Also, this Saturday is Tri-Pride. We'll be out in Bristol for that. So we're doing a parade and festival, so we'll be tabling out there. And then on Labor Day, Monday, September 5th, we're going to have a rally and a day of action. So come prepared to make your voice heard as well, and to protect workers' rights, to talk about wages, to talk about unions. And then let's go canvass. Let's go talk to voters about why it's important to vote no on one and to get me in office this November.
And Kate, what can we do if we're not local to you to help support you?
So if you're not local, you can phone bank from anywhere. So I will reiterate that so you don't have to be in the district to be able to make a change. So yes, you can donate. That's scrolling there at the bottom. I do wish money wasn't part of politics, but that's not the world we live in. So door hangers and palm cards and registering for all of these events and reserving the spaces, all of that's expensive. So help me get direct mail pieces out and newspaper ads and billboards and yard signs and all of those great things, which, by the way, yard yard signs will be here on Tuesday. So very excited to get those distributed out. But if you don't live in the district, we have lots of volunteer opportunities. So you can text bank or phone bank or even help us write postcards. But sign up here in this katecraigtn.com/volunteer, and we'll get you in our volunteer universe so that you can see the volunteer opportunities, including those to help do that. So, and if you have connections in Tennessee, even if you're not here, tell everybody you know to turn out to vote. Make sure they're all registered.
And Twitter and Facebook, and I share your stuff all the time, even though I'm not in the district. So I've got 10,000 followers, and hopefully some of them are going to listen.
I appreciate that. That means a lot to me. Thank you.
Absolutely.
Thank you for joining me here tonight. And I really appreciate everybody tuning in this Sunday evening. I know that everything's chaotic, and, as school's going back, and, I think the university, ETSU starts on Monday. So everybody's just trying to get ready. We're 2 weeks into K through 12 schools being back. So thank you for giving about an hour of your time this evening. Next Sunday, we'll be doing this right here, 6:00. And I will have Noah Nordstrom, who's the campaign manager, and Chase Lindsay, who's the volunteer coordinator, joining me. And we're going to talk about what's coming up for the campaign, how you can get involved, and why this campaign is so important. So thank you, and we will see everyone next Sunday. Next Sunday.
All right. Vote Kate Craig.
Thank you.